name is Dr. Mel Cannon. I'm a chiropractor at New Age Chiropractic. And today I'd like to talk a little bit about a very common problem that you have had or you know somebody that has had it. And that's called low back pain and coupled with sciatic neuritis, which is really a very painful situation. Over the years, and I've been in practice well over 35 years, I've probably treated 1,000 or more of these types of cases. So, and what I found is that most people that wind up with these type of problems, low back pain, coupled with sciatic neuritis, they have a lot of things in common. Many of these people have been involved in accidents, work accidents, car accidents, sports accidents, which cause the spine to shift, which cause the discs to shift, and which causes a lot of wear and tear, especially in the low back. Chiropractic in general treats this problem very, very well. And I've treated, like I said, well over 1,000 of these cases. Okay? Another reason for these problems are people who work and sit all day who do not really exercise. Exercise is extremely important in supporting the spine, whether it be sit-ups, whether it be back extensions, whether it be playing some kind of sport and keeping your body in shape, is extremely important for the low back and the entire spine. When this type of a problem occurs, we usually find that we have severe subluxations, which are variable rotations putting pressure on the nerves in the low back. And when this pressure becomes severe enough, we find that these nerves, not only which affect the low back and the low back muscles, they also travel down the legs. It could be one leg or the other, and sometimes it's both legs. And when that occurs, we are now talking about a very painful situation, and that's called sciatic neuritis. Common problem, keeps you out of work. You cannot walk, cannot bend, cannot function normally. And in many cases, you can be hospitalized, or you have to go for very heavy-duty epidural injections to kill the pain, or you go to pain management and taking heavy-duty medications. Chiropractic can and does help and correct these problems in a much more positive fashion. What I've done over the years is develop and start to use a new technique which is called ETPS, which is electrotherapeutic point stimulation. And this is using the two hand pieces that throw out a tiny electrical current from a direct source, which is a battery. And I can get right into the painful spastic muscles that are causing these vertebrae to put pressure on the nerves. I can innervate the nerves. I can create a lot of circulation in the area, and thereby releasing the tension and diminishing the amount of inflammation to the area. When you do this, you ease the pain, you ease the inflammation, and the muscles tend to relax. Patients get better at a very fast rate. So, if you have had or do have a problem with the low back or a sciatica or a combination, you can give me a call, give me a shout, or check out my website, and you can actually see me in action utilizing these instruments on patients. And one of the videos on the website will actually be me working on a patient with a low back and a severe sciatic neuritis problem. So take a look, give me a call, and enjoy what you see, and try to take care of yourself. Eat well, exercise, walk, and have a positive attitude, which is always helpful for the body because it relaxes you. Good luck, take care, and hopefully one day we'll communicate and talk.